Welcome to Conversations with the Modern Girl, the podcast hosted by myself, Shamika Patterson, the guru of mental health and well-being. Join me as we embark on a journey of exploration and discovery, as we deepen our thoughts, as we discuss topics that affect our community. I coin myself the queen of randomly thinking, and as I'm randomly thinking and having these discussions in these podcast episodes, I invite you to join me with these thought-provoking discussions on a wide range of subjects, from lifestyle trends to the culture of the Black church, and also discussing some obstacles that we face in middle-class America, also to the intersection of mental health and well-being. Be prepared to be inspired, challenged, and empowered as we engage in meaningful conversations that aim to spark positive change and personal growth. Get ready to expand your horizons and enhance your understanding of these important issues in Conversations with the Modern Girl. Listeners, for joining us again for Conversation with the Modern Girl. Today, I am thrilled to have Dr. Cynthia Brown with me here today, as we're going to talk all things fertility and women's health. Dr. Brown is the founder of Reproductive Health Studio in Dallas, Texas, called Hope Health. And what she does is help women get pregnant. As a fertility expert, she does this various different ways. Dr. Brown, if you could just share with us your credentials and how did women's health and fertility become your focus?
Yeah, thank you for having me. Yes, I'm a clinical pharmacologist and integrative fertility expert with about 13 years of training in biochemistry, pharmacy, and research. I completed my fellowship at Indiana University School of Medicine, where I specialize in precision medicine, women's health, and cardiovascular medicine. My expertise is really in understanding how medicine, food, and supplements interact with your genetics and help to heal or harm your body. With that, I was able to build drug simulation to track how hormones like estrogen metabolize in your body so that I can really tell you without having to guess where that medication is going, what it's doing, and how it's going to help you meet your goals. I can then go on to help you make more informed decisions along your fertility journey. We did some cardiovascular studies in women where I analyzed drug trials. Maybe I could kind of cut through the hype and tell you what's going to work, if a medication you're taking is really bioavailable, if it's really effective, if it'll really support your PCOS or endometriosis, or help you to balance your hormones for conception. And when necessary, I've worked with women who are going through IVF and fertility treatments, serving as an advocate for them to really showcase which medications, which treatments are going to help them reach that conception goal faster, safer, and more effectively. Beyond the science and beyond what I've studied, I was once diabetic. I had hypertension, sleep apnea, joint pain, and I was very overweight. And I'm only 5'3", and I was coming in at 200 pounds at a time. With all these health concerns, I knew how the comorbid conditions I had would impact my fertility journey, and I was really afraid that I would never be able to have that family of my own. So I took charge of things, took a firsthand approach to my own care, and dealt with my fibroids, dealt with my cysts and my hormonal issues, which helped me address the other problems like my diabetes and my hypertension. Able to use holistic methods that are still rooted in science, and we have evidence to prove that they work, as well as the things I've learned through my training to heal my body. And now I empower women to do the same without having to go to school as long as I did.
Right.
I'm really just trying to combine the wisdom we have from holistic methods of care that have worked for centuries, and as well as the hard scientific facts that we are able to benefit from due to modern innovation, so that we can conceive more efficiently, sustain healthy pregnancies, and deliver healthy, happy babies.
That is beautiful. Beautiful, very needed work. I don't think that a lot of people understand the importance of understanding our bodies
and the method that
Yeah.
we can heal ourselves. I think
Right.
I'm a firm believer, and I think that we have everything we need to do that process. We just need the
Yeah.
tools and the directions on how to do it. I love that you
Yeah.
said that you healed yourself. You're about diabetes, your hypertension. You took those core modalities and understood them and found ways to reduce your lab work, to reduce those
Right.
symptoms that you was
Right.
having, for that to eventually eliminate having
Right.
those illnesses. And it is possible.
Yeah.
It is possible.
Yeah.
And I think a lot of Black women, we face some of those things, especially in getting pregnant.
Yeah.
There are
Yeah.
young girls that get pregnant and they already have diabetes, they have hypertension. I was
Yeah.
speaking with some OBGYNs and they were saying the numbers of them that come in that's already diagnosed with these illnesses is
Right.
astounding.
Right.
And when
Right.
you
Right.
are considered a Jerry pregnancy, over what is it,
Right.
35 or whatever it is, and no, it might be over
Yeah.
30. When you're considered that,
It's 35, but for some, I've seen 32
why,
for some who they were like, it's cobwebs in there. I don't know. Yeah, that hurt my feelings.
right. It hurt mine when
But
I was
yeah.
pregnant. Yeah, I was like, I think I was maybe 30, and that was considered,
Yeah.
high risk.
Yeah.
And so,
Yeah.
of course, there was the concern out the gate about hypertension. There was the concern out the gate about diabetes and taking the glucose test.
Yeah.
And I know they do that with all
Yeah.
women in pregnancies, but it is really a focus on Black women. And to understand and know that you have studied this, and not only studied this, but you have developed a plan that has worked for you and that is
Yeah.
working for other women is great work.
Yeah.
Great work. So, how has your
You're
work
very
with
kind.
precision medicine changed the approach to fertility treatments? What are some of the most promising advancements that you've seen here recently in doing that work?
So I focus on precision medicine in my fellowship. And precision medicine really means individualized, personalized care. It looks at you at the personal level and not just the population level, where um, we sometimes the unique and intricate details of your genetics, your metabolism, and specific biomarkers can be overlooked. So when I come up, when I'm encountering with a new client, I am looking at them. Like, I'm looking at the Kiara plan. What does Kiara's need? What is her body telling me? Instead of just the PCOS plan, the Black fertility plan, the women who are with 35 plan. So that kind of training is why I look at women at the individual level, and I'll look at things like your genetic history, your family history, if you have like genes for some of these things, because as Black women, we do carry some predispositions just in our genetic code. Some things that'll make it harder for you to lose weight. That'll make
Right.
it harder for you to conceive. So I try to educate my clients on that first, so that we can take away some of that guilt and shame
Yeah.
and really just misunderstanding. So I'm really glad that I have that precision medicine approach that can tell me it's not your fault. It's in your gene code. It's in the way your body has been coded to metabolize food, metabolize this drug. I can tell you that. So I'm really glad that my training helped me understand people at the cellular level, so that I can help you take away some of that, the associated shame and guilt.
Right.
But to answer your question, I'm sorry, but to
No,
answer
this
your
is
question,
information.
we do have some advancements like the endometrial res- receptivity analysis, ERA, where we're able to identify ideal implantation windows to improve the success rate of IVF, for example.
Mm.
There's also genetic testing, which can happen again through IVF and the embryo selection process, or to reduce risk of miscarriage. They're now beginning to use AI even in selecting embryos, which I know kind of scares some people. That's a kind of a touchy area. But there's also things like we can do hormonal modulation, where we can test their hormones and adjust accordingly to really support better metabolism and drug response. So that a lot of these are still theoretical. You won't find them always readily available. They're very, 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 very new. I mean, like we just got the data out in the last 4 to 5 years for some of these therapies or these treatments. But it is a great way, I think, that we are really beginning to look at, again, what's happening at the cellular level with building blocks before we even get to you have diabetes and you can't get pregnant. Let's really figure out what's driving some of these issues. Let's really figure out how can we do this smarter. I utilize some tools in my practice. Like I have a couple fertility monitors that I use for clients. I always tell them I'm very data driven. That's just because of my training. I need to see the numbers. I don't give you anything that I don't have numbers behind. I would not give you a supplement even if I don't have data to show me that it's going to be bioavailable. It's going to work for you. I don't. And then with our fertility monitors, I tell them, like, it's going to be annoying. I'm going to ask you to go pee on a stick every day and test it and tell me, but I need that data so that I can help you get pregnant faster and more efficiently. Or I can tell you, you're not ovulating completely. There's a halt somewhere in the process. We need to figure out where your body is halting along that hormone cascade and help it so that you can actually release the egg. Because I find often with women I encounter, they're not even ovulating. And I'm like, you don't have anything to get pregnant with. So let's get you ovulating again before we start saying you're infertile, you're broken. That's not even true. Your body just needs a little bit of help. So I like to use these tools to see the data and have your body talk to me so that I can really understand what's happening. And again, like looking at that personalized, yet global approach, looking at how your body is a big system and how each system works together and how that is impeding our success with the fertility.
That is so amazing, the work that you're doing. And I really like the clear understanding that everyone's body is different. So our bodies
Yes.
process differently. It's not a cookie
Right.
cutter type of ordeal. Like you
Right.
say, you go to the doctor
Right.
and you keep having these miscarriages or failed attempts at getting pregnant, and it's, you need
Right.
to lose weight. You have diabetes. You need to change your diet. You need to work out more. You need to do those things, and those are not always the things. It's chemical. It's some type of chemical or genetic
Yeah.
something there
Yeah.
that is prohibited. Do you
Yeah.
know how many people have thought that in their minds and just wanted to be validated in hearing that? Because there are
Yeah.
several women that were working
Yeah.
out, eating healthy,
Yeah.
doing everything that they're supposed
Yeah.
to do, and they still weren't able to get pregnant, and they walk away with this
Mm-hmm.
brokenness, feeling like, it's just not
Yes.
going to happen for
And
me,
it's so frustrating.
Yes, it's very frustrating.
Yes.
So to know that you're doing the work to identify what is going on chemically with your body, testing,
Right.
getting data, so you know what is going to work for this individual to
Yeah.
help them conceive is
Right.
God's work. It's God's work. That's what you're doing.
You're very
God's work.
kind. You're very nice. Thank you. No, I mean, you're absolutely right. I mean, like I'll use my family for example. I have a history of hormonal issues for myself. I started menstruating when I was 8 years old. I have possibly fewer eggs because I was losing them sooner. I've had ovarian cysts. I mean, like where I could not move. I was in so much pain. I've had days where I missed school because I was in so much pain. And you're just told that's just what it means to be a woman.
Right.
All of my sisters have hormone related issues. We were all on birth control regimens and then off. And I have sisters who have struggled with weight and just how our body metabolizes the food we eat.
Mm-hmm.
Not even because they're overeating. We eat the same thing. It's just coming out different with her.
That's right.
On my mother's end, they have histories of cysts, fibroids, and multiple miscarriages. It's in the blood. It's in our blood. So when I got pregnant, that was why I was so concerned. Like, can I sustain a pregnancy? Genetically, my body might not, be able to see it through. I have my own localized data of looking at my family, looking at my sisters, looking at my own history that's why I was like, let me help myself and deal with these health issues to really give my body a fighting chance, because there's something in my DNA that is probably predisposing us to hormonal issues, where every single one of us women has a hormonal related issue and is miscarrying repeatedly. That's strong. I mean, strong, correlation is not causation, but that's a strong message,
Yes, that's an
So
indicator there. Yeah.
Yeah, there's something going on. Right. Yeah. So I like to share that with my clients, like, this is what I face. This is what I was afraid of. And, especially in the Black community, a woman dealing with quote unquote, female issues, and you're not able to conceive, or you're having difficulty, there's so much shame
It
attached to
is.
that.
It is.
So I mean, I'm a big proponent of that, especially with, I have a lot of clients who have PCOS, and I tell them, like, do you know you probably carry the genes for it? They didn't know it was genetic. And I'm like, it's on the male and female side.
Mm.
So it's in your blood. So there's not yet a gene therapy that can slice out these things. And this is the pessimistic side of me being, typically Black people, we are the very last group to be considered.
That's
So
right.
even if there was, I don't think they'd be talking to us.
No.
Not yet anyway. So, I mean, so I try to say these things, not to be negative, but just to educate that it might not be you. It might just be like literally what your DNA is saying to do with the
Very much so.
hormones. And what we have to do is just work in accordance with your body. And that might mean, being more stringent in some ways. That might mean being more loose in some ways. But we have to just talk and try to work in harmony with our bodies.
That's so right. And listen to our bodies. I knew nothing about
Right.
endometriosis or PCOS
Yeah.
until
Yeah.
I was trying to, getting pregnant. Before I got
Yeah.
pregnant, I was told I had endometriosis and that it was a possibility that I would not be able to get pregnant. So I formulated in my mind that, okay, I'm okay with not having children, because
You
someone
have to have
somewhere
that
told me
quiet
that.
resolution.
Yeah.
Right. It's not even like, where I'm comfortable with whatever happens. It's like, I have to be comfortable because it will not happen.
It
So
won't
let me
happen.
just get my mind there.
Yeah.
So I don't have to be forced there.
Exactly.
Like, and I hate that. I meet so many women that is where they've just resigned themselves to. And I'm like, that's not what you really want to be. So you're saying that because you're trying to convince yourself.
That's right. You want
to convince yourself.
You've been given this information, and now you're convincing yourself that it's not going to happen for me. Thank God it did happen for me twice, naturally.
Yeah.
And so, it's and it makes you think, okay, that was a great blessing, but also look at the misinformation I received. What if, I just didn't even try? You just don't know. And so I love the beauty of the work that you're doing. Can you tell me, how can personalized wellness plans enhance a person's fertility journey? Like, what role do pharmacists play in this process?
So sadly, there's not very many pharmacists in my field. And that, I just think it's kind of an unmet need. And I think it's because sometimes people don't really understand what we do as pharmacists or what our education and training is. And granted, I did kind of go beyond what a conventional pharmacist would be trained in, to where my education is really more applicable in spaces of like drug development, pharma, and more integrative care. But for me and my plans for clients is optimizing their fertility by addressing metabolic, hormonal, and inflammation factors that impact your health. So looking at a precision-based fertility plan that considers things like genetics, as we talked about, nutrient deficiencies, detox pathways, and stress response. For example, a lot of there's been some studies that showed that fibroids respond very well to vitamin D, for example. And some of the driving factors of fibroid development is due to a very severe lack in vitamin D. As you know, as Black women, as darker skinned people, our bodies are often lacking what? Vitamin D, because we don't get it from the sun as well. So I'm like, okay, we might need to start making sure that, and I had this issue too, where when I got my labs tested, I had severely low vitamin D. And I'm like, that's probably why I'm sad all the time. So, we're looking at, a Black female patient with fibroids. I'm gonna look at your vitamin D. And 9 out of 10 times we need some more vitamin D. Let's start there. Let's give your body what it needs to build the blocks. I often, when I meet with clients, like, I've been trying this and trying that and trying that and trying that. I'm like, okay, what are you taking? Let me see it. Is it third party tested? Do we know that it's actually bioavailable? Often it's just, they're kind of just throwing things at the wall, hoping something sticks. And I'm like, that's why you have me, to tell you the answer, so you don't got to experiment with your body anymore. I can just tell you what's going on. I can just tell you how to help yourself. I can just tell you, you are a darker skinned woman. Your body's not going to receive the vitamin D the same way as a lighter skin or white woman is going to. You have a history of fibroids. Let's start with increasing your vitamin D levels to give your body a fighting chance. You have high C-reactive protein. Your body is on fire. Your body cannot produce a baby in a house that's on fire. You're asking your body to bring a baby into a burning building right now. Let's work on your inflammation markers and getting those lowered so that your body is not on fire and thinking, I can't get pregnant right now. So I try to be the bridge between what those lab numbers are telling you and what your body is telling you, and really helping you kind of work in more harmony. And doing that by optimizing care. So I have protocols I've developed for PCOS and endometriosis. And then I say, okay, you have at least 2 or both of these. Let me look at your labs, okay? And then I optimize them and tweak them. So I have kind of a skeleton that I protocol that I start off with, because typically if you have PCOS, you're going to have some of the same underlying driving factors. But then once we get back your labs and once I get back your history, I'm like, oh, okay, you actually need more of this or less of that. But I have a framework, to start off with. I can communicate to you, here's why I'm giving you this, because it's going to help with this. Here's why we're not doing that anymore, because that was actually hurting this. So I try to also make sure that I'm educating the client along the way so that they are leaving me more empowered. Like, they're like, I have the tools to really, really help my body in a meaningful way.
I love it. When you speak to the vitamin D deficiency, I have not come across a Black female that does not have that deficiency, as well as Black males too. And I was always told my vitamin D was extremely low. And I would take medication over the counter as advised. It would not increase. But in the last year or so, I started taking Black Girl vitamins. Shout out to her. And when I went back to the doctor, my vitamin D levels were very elevated, and I felt better. I was able to, I was not as constipated, and that was related to the vitamin D as well. It just was a whole game changer, and I just was so thankful for that. And like I said, shout out to her, because it was amazing. Black Girl Vitamins was the one. Yay to her. It did miracles for me. So I understand when you say that. And I also understand when you talk and speak to getting that information about your fibroids and things, and then attaching those levels and inflammation. When you said the house is on fire, the house is on fire. That's that inflammation. And I used to get lab work back that said I had inflammation. I think it was the SED rate that would be elevated. And no one ever explained to me how that was happening, why, or what I could do to get the inflammation down out of my body.
To help it down.
I'm curious about that.
No, I mean, I'm really glad you touched on something I want to explain. When you're, one of the annoying parts about supplements sometimes is that they're not always well regulated, which means that what's on the bottle is not necessarily what's in the bottle, because there's not third-party testing to really test and make sure that everything that they claim is happening is going to happen is in the product. They're not always very bioavailable, which means when you take it, it might not act, the amount of drug you need will not get where you need it to go. So that's probably why when you changed over to a better product, you were actually seeing results. Like, I've heard a lot of good things about Black Girl Vitamins. And that's why, like, in my practice, I only use supplementation that is third-party tested, and preferably open source, so that I can actually look at your testing and look at the studies to see what you're talking about, because I can interpret the trials and understand them. But that's a big major gap we have in the healthcare system, is that these health products are not well regulated and not well tested. So people can really be selling you anything.
Right.
Which is so scary and frustrating, which is, you say, I'm doing everything I'm supposed to be. What you're taking is nothing. It might as well be a water pill.
A placebo.
It might as well, be nothing. So that is it's so frustrating. And it adds to the frustration, because some of these things are very expensive too, and don't do anything. Will not do anything to help you, are useless, So there's a very short list of products that I actually use in my practice, and that's only because they're third-party tested. And we know that they are giving you what they claim to be giving you is going to actually help you. I'm so sorry you had to navigate that frustration by yourself.
Right. And I'm just,
because doctors know this. Like, it's not a secret.
Know.
Someone should have told you this years ago.
Yes.
It's not like I didn't just unlock something.
Yeah.
Like an industry secret. No, it's very like
it's common knowledge in that medical world. They were gatekeeping.
It really is. It really is. Yeah, I guess so. I don't know, but that's just silly. That's why, when I get on a call with someone, I'm like, no, I'm taking everything. I'm like, let me see. I ask them, who tested it? What do you mean? Which lab tested it? Have you seen the data? Have you seen the numbers? I'm like, well, it's just good branding. I don't care about your branding. I don't care if it comes in an ugly bottle, if it's going to actually do what we need it to do.
That's right.
So a lot of this stuff is just good branding, and it's so frustrating.
Oh, my, so frustrating. Yeah. I am amazed again. I don't know how many times I can say it, but amazed by the work you're doing. What I really love that you said was, outside of your profession, you advance and you use that as your stepping stone to deep dive into other things chemically, to gain more knowledge medically. And that's what we have to do with our education. I'm a strong believer in we are to get our education and return it back to our communities and find ways to help one another. And that's what you're doing. It just doesn't stop at what you were doing, your baseline. You continue to grow, evolve, discover, and use that, like I said, as a stepping stone to find out and discover other things that can help so many other women. And that is amazing. That is amazing.
No, you're sweet. Thank you.
Well, tell us how people can get in contact with you at your facility. I know you're in Dallas, Texas. And so can you tell them how they can get on your website, any events that you're coming up to, any ebooks or anything that you have that you're promoting? If you could just let my listeners know.
Yeah. There's a number of free resources at our website, copellahealth.com, Kopela, Copella, it means girl, health.com. And as well as there are nutritional guides for PCOS and endometriosis, so you can eat for your hormone imbalance and actually heal your body through nutritional care based on what your hormone imbalance is causing you to lack and what your body needs to reach a state of healing. And there's also a link on there where you can get in contact with me one-on-one if you want to go on this fertility journey and you need me to yell at your OB. If you need me to educate and advocate for you, that's what I'm here for. I will be happy to sit down with you alone or you and a partner, however you choose to start your motherhood journey. Otherwise, you can follow me on Instagram or on Threads. That's Dr. Cynthia Brown, Dr. Cynthia Brown on both platforms. And feel free to just reach out via the website or email us at support@capellahealth.com. We usually try to get back to people within 24 hours.
Amazing work. I am so happy to have had you on the show today. It has been amazing. I like the education that you provided today. You've been a godsend.
Yeah.
Everyone, please take the
You're
time to
sweet.
find
Thank
her
you.
on the socials, and
Yeah.
also take the time to follow me on Modern Girl Movement on IG, also on YouTube, and tell a friend to tell a friend to tell a friend to tune into Conversations with the Modern Girl. We're educating the people. We're bringing the light, and we're educating the people because we want you to know, girl. So make sure you follow us. Thank you again, Dr. Cynthia Brown, for your time today and your commitment to medicine and your commitment to women all over the world. Thank you so much.
Thank you. You have a good day. Thanks for having me. Bye.
Thank you to all the listeners out there. I ask you to please go to my YouTube page and like and subscribe to Conversations with the Modern Girl. Also, take the time to follow me on my social handles. Instagram is Modern Girl Movement. Facebook, same Modern Girl Movement. Thank you.